The pattern of behavior that a person adopts certainly has an impact on his health and well-being. Much as everybody desires a lifestyle that will guarantee a long and enjoyable life, most people unfortunately adopt patterns of behavior that not only result in ill health and huge medical bills, but also in preventable death.
You could be smoking for maybe the last 10 years and decide one day that you have quit smoking. But obviously, your health had degenerated over those years that you were smoking. You could be drinking very hard and decide that from now on, I am not going to drink any alcohol. But you've forgotten, something has happened to you over the period. And you might have gone through a sedative, lifestyle, not moving around, not doing any physical activity. Something has happened to you. And you might have been eating fatty foods, sugary foods, foods with a lot of salt and all that. Again, something had happened to you over the period. So your health would have degenerated over a period of time. So the first portion is that, is there anything we can do to help you regenerate your health? So that's the first component of what we are trying to do.
The Regenerative Health and Nutrition Program has been developed to help Ghanaians adopt a pattern of behavior and lifestyle that has helped a group of Africans virtually eliminate all disease and illness from their community, and where 3 generations have not witnessed a death among their peers.
I and other members of the medical team from Dimona came to Ghana in April 2006 and met with a number of the department heads in the Ministry of Health and Ghana Health Services and listened to them describe the circumstances which were affecting them and the health of the general population. We realized that the number of deaths and sickness which was taking place was really unacceptable, and accept that we came forward with a plan that was energized and demanded all of our strength, that we might marshal all of our strength to resist these diseases. We would simply become a disposable labor pool for other people to enjoy and enjoy the benefits of our land. That's totally unacceptable in this day and time. We had to come back with a way that we could begin to prevent these illnesses from decimating our families, decimating our communities, and we could remove funerals from the list of social events that we attended each week. That was extremely important to us. And that is when we began to share with Minister Courage Kwashiga, the Minister of Health, what we saw, and he shared with us his vision, which was in perfect harmony with what we were doing already in Dimona, Israel. And it all became a natural that we should join forces and join the effort here in Ghana to make this a reality.
But what does a healthy lifestyle entail?
Healthy lifestyles is an acknowledgement that everything matters where our health is concerned. The tendency of the medical establishment, predominated by Western ideas, is that you isolate different organs and systems of the body in a search for what causes illness and disease and sickness. And what the evidence now is pointing us to, and what is very clearly obvious, is that the body, or that good health, is actually the linkage of all these interconnected systems, and it boils down to a behavior, not one individual behavior, and certainly not one type of pill that someone can take, but a whole complex series of behavior that we call lifestyle.
To most people, the word exercise is synonymous with a gym or keep fit activities. These are, of course, very highly commendable ways of strengthening and keeping the body healthy. The Dimona team makes it apparent that exercise could be less strenuous but still achieve life-saving results.
Every decision we make affects our health either positively or negatively. So therefore, we have to make some very sound and knowledgeable decisions. One of the first areas of importance in healthy lifestyles is exercise.
The need to exercise the various systems of the body. Exercise usually tends to just bring in muscle strength. Well, that's just one element, but there's also your cardiovascular. The heart is a muscle in itself. The blood pumps the nutrients to various parts of the body. and it has to help and assist to remove the toxins from the body as well that accumulate. So exercise is an important component of that. It strengthens your skeletal system.
I'm 64 years old, okay? And as you get older, sometimes you can feel in your knees. These are strengthening exercises too. You know, you can even do this, just lightly up and down, not going all the way down, but going all of this. Now, exercise, if you be consistent, is when you get the benefit from it. It is very important. Now, again, because we become older does not mean we don't exercise. Then you can go and you can march. If you're in your bedroom, you can just march for about 15 or 20 minutes. Just march, okay? And then you can just walk up and down marching in the room. All of these things are very, very important that you can do inside. And when you reach 40 and above, it's important that you get out and take some long walks, and you must exercise at least 3 times a week.
Essentially, that first we talk about a component called the people-to-people ecology, which is
your brother and sister is as important as your diet that you eat, and also exercise in promoting good health.
Everything is involved in our health, our environment, our relationship to the environment, but not just the environment, but how we relate to other people. There's a saying often sometimes people may use when someone vexes or frustrates them. They say, "You make me sick." And indeed, we know that there are people, there are relationships that can draw negativity to that relationship and indeed cause sickness and disease.
Your relationships with the individuals around you cause your emotions to go up, down, you be happy or sad. Well, that is an impact upon your health. And so it's important for us to evaluate the quality of our relationships and to make sure that we are doing everything that we can to maintain, as I said before, a very peaceful and harmonious involvement. Certainly some stress is going to come, but let's make it manageable stress, things that we can deal with and not add to in terms of the relationships that we're having.
Touch therapy, the idea of a massage to assist the body to move those fluids through the body. The body's 75% water, and most of that is found in the bloodstreams, and it moves through the tissues. Well, deep tissue massage can assist the body in moving those nutrients where they belong